Did you hear that some nutrient deficiencies worsen COVID-19 outcomes? Hi, I'm Dr. Ina, Digestive Reset, and I'm here weekly to answer all your questions and give you my tips for digestive and hormone health so your immune system is in great shape. Please always speak to your doctor while consuming our content. Selenium and COVID-19. Some health sources are now suggesting that selenium deficiencies may possibly increase the risk for serious complications with coronavirus disease. The current level of evidence is not strong, of course. This is something relatively new, and we cannot expect the data to be there. Two population-based studies linked low selenium levels to severe COVID-19 outcomes, including risk of death. But both studies were really small. What we really know is that true selenium deficiency is rare. Most people consume enough of it in their diet, but many with thyroid problems benefit from selenium supplementation. And it will not hurt to pay more attention to getting enough selenium to feel safe. Fish, poultry, beef, eggs contain a high amount of selenium. The recommended daily allowance RDA of selenium is 55 micrograms, and eating just 3 ounces of salmon provides about 40 micrograms of selenium. Please note that if you're supplementing with selenium, doses above 400 micrograms may increase the risk of toxicity, so please get monitoring. And there's always functional testing if you are ever ready to check your micronutrients. I often recommend that to my clients, and we uncover very interesting things after seeing the results. Vitamin D and COVID-19. Current official recommendations for vitamin D dosings are changing, and while they're back and forth on those, we could do a few things. We can make sure that we get some sunlight. You need about 15 to 30 minutes of direct sunlight each day. And if that's not an option, food and supplementations are your next best bet. You really should be getting vitamin D levels tested regularly, especially if you have a chronic condition. Even with not sufficient data regarding positive outcomes in COVID-19, we have plenty of supporting data for vitamin D and chronic conditions like Crohn's, colitis, and others. Foods that are high in vitamin D include fish, and the king of vitamin D food sources is cod liver oil. If you cannot stand that, some people really can't. Your next best bet would be swordfish and salmon. I know some people that just do not consume fish. Well, thankfully, we have the testing options and amazing supplements today. I generally recommend vitamin D to be combined with vitamin K for best absorption, and it's always important to have enough calcium and enough magnesium in your diet to improve vitamin D absorption as well. And if you know that you're not getting enough calcium and magnesium from your diet, you can always supplement in combination of all these nutrients I just mentioned and vitamins. I wish you great health, and below under the video in the notes you will find the recommendations for trusted supplements. I would love some feedback. Please follow the page, subscribe, comment under the videos, and I know you have questions. This was Dr. Ina with you, Digestive Reset. Until next time.